So right now we're planning to do a full face and neck treatment on this patient for skin tightening. And if you want to select a candidate, this kind of skin on the neck, which has that very fine kind of folding, we call it crepiness to the skin, is really something that improves dramatically with this procedure. So we like to do this all the way from this part of the back of the neck up onto the lateral part of the cheek, under the orbit, and down to the base of the neck. This whole area will be my left side treatment area. When I treat that area, I will divide it into probably 6 sections. If we turn a little bit more, thanks. This will be kind of section 1, section 2, section 3, section 4, and then up on the face will be 2 areas. Those are not things that we have to stay within the limits of those sections, but it gives you kind of the best size area in order to keep the continuous motion, get good heating quickly, and not go beyond that pain threshold. So this is a very comfortable treatment. So I'm going to go ahead and put some jelly. Now I've already tested this patient's skin temperature before we start. She's starting at about 28, 29 degrees with our external gun, which is really our only tool at this point that we can use to determine just what kind of energy we are delivering. I'm setting my settings on my Skin Tyte monitor. I do 1 pulse over 11 seconds, and I've been delivering 150 joules in that 11 seconds as 1 pulse. This is kind of what I have found is the maximum energy over time that works comfortably in the areas that I'm using as far as the size of area. It could vary depending on patients, but I want to get that change in temperature. Usually I heat the temperature up about 10 degrees, which will reach a place where she's still comfortable but feels the heat, and then I see some pink change in the skin, which tells me that we are getting an effective treatment. So we will start with 150 joule fluence, 11-second pulse length, and I set no post-cooling with motion because you don't really stay in one spot that requires cooling after the crystal is removed. One other thing I might want to show you, I think you can see on the end of the handpiece there's a crystal cover. This is that smoothie we were talking about. It can be removed. There's your cover. It's just a magnet that holds it over the sides of the lens, snaps on very easily, allows the edges to be very smooth along the side so that we don't have anything that's irritating the skin as we move. So we'll go ahead and start with a pulse. So we're going to start and just feel, this will feel a little warm as we go, and you're just going to tell me if you feel anything that's really uncomfortable as we move. I generally will do 1 area, about 3 pulses on the first pass. And 1 more. Start to warm up. We've already got a little bit of redness, you can see in that area, and she was feeling it be warmer enough that it was obviously changing that skin color. I think you can see that. So we move to the next section. Now she got a little bit warm before we'd even finished 3 pulses, so I'm going to do each section 2 pulses, and then we'll start joining the segments. When we're closer to the jawline, the energy tends to be a little bit absorbed by more over bone, and it gets hotter quicker. So you just, we're going to continue down in this segment. So then we're going to just start to overlap the segments a little bit so we move in a different area.
It's warming up.
Okay, then I'll move. So basically you can move, as you see the redness, you can change your area, and then I generally, once I've started to get the temperature kind of up, then we can start kind of moving over a larger area to just maintain that response. Some patients do get very sensitive if you stay in a smaller area, then I just extend the area. As long as I'm seeing that I'm getting the energy and I'm getting that pink response, I can move those energies around, those segments around, so that we don't have to be on one spot. So I can feel the temperature with my hand, quite warm there, and we are getting really a nice erythema, which is comfortable but still enough on that spot. So then we'll come over the jawline a little bit. And add that to our treatment area. And you can move up and down and circular. It's really not, it's just getting a feel for how the skin looks and how the patient feels. And this area, you don't stay on one spot too long over the jawline because of the, I'm putting 150 joules per pulse. It's really 3 times what we would, more than 3 times what we would necessarily be delivering in a stationary technique. So it's certainly okay to have a fairly large area as long as you're seeing your energy and your redness and your heat is just
Starting to get warm.
and she's starting to be aware of the warmth. Then we can just stay off that bone for a minute. Then we'll do one right up on the face. And then over the lateral cheek. And it really doesn't matter, as I said, whether you find it's going to glide easier on that particular facial features of the patient. If you can move easier in one line than another, there's no rules to the area that you consider a segment. You just want to make sure that you're not overheating one area that's making it uncomfortable, and you're getting the whole area to stay to temperature. We're getting, over the cheekbone, you'll find that it gets warm a lot quicker. And to do the detail areas under the eyes or along the upper lip, we move to a smaller tip smoothie, which really makes that possible to treat as well. So you can see now, and I can feel that this whole area is now quite pink, but you're still comfortable, and the neck is still maintaining some of that energy. So we've done about 35 pulses, and that's probably all I would do on that treatment side, and she's pink, but not uncomfortable. You can feel heat. I don't know if I'll get anything with this. But she's 38. It actually cooled down a little bit after but anything from 38 to 41 is kind of what we end up achieving with the energy, and this you can certainly see the redness, I think, all the way maintained in this treatment area. So what I would do next is move to the center. I tend to treat this central part as a separate area so I can really get some tightening on this under the jaw, under the chin, Everyone loves to see that as tight as possible. We tend to get a lot of people that, because that's always a little bit crepey and folded, they can call it their turkey neck if it's really got a lot of redundant tissue, but they'll see lines from just sun exposure because none of the creases are ever seeing the sun. So Kathleen does a very good job with taking care of her skin, and she doesn't have any suntan lines, but definitely this is a treatment area that really we like to cover specifically for patients. They're always going to ask you, did you get my skin under the neck, under the chin, on the neck? And one of the places we can see our best results. So we do the same thing. We just kind of find an area at the base, call that our section 1, and we do 1 or 2 pulses. This area heats very quickly because you're, in fact, right on a thin skin area over some vessels, and people really will notice that warm up pretty fast. And then we'll just come up into the second section. And you really just kind of customize how you move it. As long as you keep it moving, they won't complain. And you can tell by just how the skin is responding. If you have an external temperature probe, you can check your temperatures, trying to see that we stay, really for sure, should stay under 42 degrees, because we know the skin deeper is certainly warmer than what we're seeing on our external probe. And we don't want to get to that 44 degrees where we actually destroy collagen. We want to just melt bonds and get remodeling. So generally in this section I do 10 to 15 pulses, depends on the patient. And so we'll do one more in here. And that should be pretty good. You can see the pinkness. On this side. Okay. Again, you can feel the temperature. You certainly will feel the skin quite warm to touch. And you can see there's a pretty even pinkness to the skin, so you're really getting and feeling that. I know from experience that's going to be at about 39, 40 degrees. When I want to do a smaller area, especially if I'm using the small tip smoothie for over the lip, upper lip or under the eyes, then I usually decrease my pulse length to about 8.5 and take the joules down to about 100, which is a somewhat comparable setting. The reason is the area is so small. You want to be able to do a very small still motion technique in a small area. You usually have a shorter pulse. It's just a lot easier to manage. And then you can reposition to a new area and not get too hot on the skin before you need to go to your next pulse. So those are my settings for the small tip smoothie, doing upper lip and under the eyes. And under the eyes is the same thing. I try to break it into 2 sections, but I usually find that you have to really keep moving. You can turn a wee bit so he can see a little better. And so we'll do a pulse under the eyes, and it's just the same idea. And usually I can deliver 5 pulses per side. And it's just a question of how quickly do you move, depends on how much they feel it and how much you see the pinkness come up. And it's almost as predictable as it can possibly be, is that by pulse 5 you'll see some redness and they'll tell you of some warmth. How you doing there?
I'm feeling just a little warm.
Yeah, so she's starting to feel that warmth, so we can start doing a little bit more. She's pretty good, so we can do kind of this area, a couple more pulses, and the more energy the better. We're still getting something right over that lower eyelid and lower orbit area, not actually into the orbit, but just below on that. Again, where the loose skin tends to sit in that tear trough. And this can be done, really helps with people that do fillers here, because that really increases the amount of tightness over that skin. Over the filler just gives them an even better result. They don't see through the skin as much. It's actually giving them a little bit thicker skin there. Just that denser collagen on that thin skin just really helps cover or smooth out those lines and cover that venous pool that we all have. So you can certainly see that there's some redness and see the smoothing. These lines that were over here are literally gone. And then we'd repeat the same process on the other eye. So what we're going to do here is demonstrate the motion technique now off the face. This is to see some of the crepey little fine lines and improve over the abdominal area. And what I wanted to point out as well is Skin Tyte is an absolutely safe treatment. This patient has a little tan. It doesn't matter on skin type. It doesn't matter whether she has some tan. You can see where there's areas that are less tan. We can do Skin Tyte safely on any skin type and with or without recent sun exposure. So we're going to begin by doing this whole abdominal area. We'll divide it into 4 quadrants, and this is Skin Tyte off the face. So we're setting our settings for Skin Tyte are 150 joules, 11 seconds for our pulse length, 150 joules delivered per pulse. I still leave off the post-cooling because there's no need for cooling with motion, post-cooling with no, and I leave the temperature at 20 degrees. So those are our settings, and we're ready to go. So what we're going to do is try to improve the firmness and smoothness of the skin. And if you look carefully, you can see how these fine lines, which actually show much more when she stands up, are bothering her because her skin looks just creepy, and we want to have it smoother so that this actually softens and evens out this whole area. A great time to have skin tightening on the abdomen is after delivery, where you have that kind of stretched skin that just needs to snug back up, or certainly after liposuction where or pro-lipo, where you're doing just maybe a little area of fat. You're going to get that nice smooth skin back over that surface of the abdomen that gives you a really natural looking smooth contour. So we're going to go ahead and treat her abdomen. We're going to be treating with the smoothie, and even though this area obviously doesn't have bony prominences or things that would bother you, you will see as we move just how easy with motion we can glide over the skin and not give ourselves any problem. So there's no discomfort from moving the crystal along the skin surface. So we'll start by warming a quadrant. These are our 4 quadrants. So this is 1. And usually in a big area I will do 1 pulse just to let the patient kind of get the feel of it on each quadrant, and just to see just how sensitive any area is as far as, you know, whether they feel any heat or I see any pink surface changes. Usually with a larger area, in fact, is less sensitive and we can do smaller and more repeated passes. So that's showing our 4 quadrants. So 1, 2, 3, 4. So we just now are going to come back and see one quadrant a second time. And now I'm going to actually stack 2 pulses on the same quadrant to see if I see anything. And if you get some warmth or feel heat, you can say, I'm feeling it getting hot. Patients are, when you're off the face, very able to talk to you and tell you what they feel. So you can see a little bit of pink coming, but nothing too much. I'm going to do one more on this area, and then so we're going to do 3 in one quadrant. And that's getting that probably to the treatment level. So we're seeing the pink a little bit showing there. I'm still going to stay in fairly large quadrants. I'm going to do 3 pulses in this quadrant. Again, this is a very large area treating. I'm going to do 3 in this area too. So treating pretty quickly, getting to temperature. And especially in the abdomen, the motion absolutely is comfortable where there's fatty tissue. Usually, you know, you've got some degree of cushion and you're not right over bone. You're not going to have much discomfort from this. Certainly no need for numbing and no need for cooling. Now you can see where some of these areas are still actually getting pinker after we've moved off of them. So you can see where there's some reds. I'll just smooth out my gel a little bit. These are the hot spots that are coming up, and we're really just going to go to the point where we get that nice absorption of the energy as evenly as possible over the treatment area. We're getting a little bit, as it accumulates, redness in the general, so I'm going to start overlapping areas a little bit. And usually around on the tummy, I try to work kind of over the umbilicus, just kind of occasionally, because that does tend to be an area that the skin is thin and they can get a little bit warm there. So we'll just now mix it up. We've been all over the 4 areas. So we're going to do a little bit more just in the center. And sometimes if you feel like an area, you can slow down a little bit. How are you doing there, Christine? Is it comfortable?
Yeah.
Not feeling any kind of
No, it's just a little
burn?
warm, that's it.
Okay.
That's good.
Most of the time, patients really feel like this is like a hot rock massage. It's just really comfortable. They can fall asleep on the table. They're not worried about you doing anything that's going to make them jump off. And so we're getting to a nice, so I'm going to just smooth that out a little bit so we can see a little better. You can see how we're getting a little pink here, and we're just going to work in this area. And sometimes I will work on a continuous where I'll just kind of keep working around. You're kind of moving the pulse slowly as you're covering the area. There's no real rules, as long as you do kind of keep that motion concentrated enough in one spot that you're seeing the energy build. So we're starting to get a little bit more even redness. And if I wanted to take my temperature probe now, I would bet that I'm going to be seeing that at about 39 degrees where it's nice and pink. Sometimes in the abdomen, because there is fat that can store some of that energy even deeper than we're trying to treat, it'll radiate back up and you'll see the pinkness actually get more, even though the patient's fine because she's not feeling anything on the surface. The surface is not burnt, feeling hot, so she's not uncomfortable. Is that still comfortable?
Yeah.
Yeah. So you can sometimes, and they do want to kind of move off if an area is really getting red, because sometimes they will have no discomfort and you are definitely to temperature. So that's kind of how you blend your areas, and you just kind of keep it moving. And you can get a lot of energy down. We're putting 100, 150, I went a little too fast there. We're at 28 pulses, 150 joules per pulse is really. So you can see the nice, I'm going to do a few more right around the tummy button and we'll be almost done. I like to feel like I've had at least, at 11 seconds per pulse, 5 pulses, or 60 seconds plus, with a nice maintenance of that 39, 40 degrees on the surface, which we think translates to about 42 degrees down in that deep dermis where we're trying to get our reaction in the collagen. So we try to get our 5 pulses without having to give up any of that heat. And with the motion, we can just keep doing it. And it's very comfortable. And frankly, you can do this on any part of the body and always improve the skin. So I'll do one more and then you can kind of see. So there you go. If I'm doing this, I would now kind of probably move out here and just do a little bit more to extend this. Go back to your 4 quadrants. You feeling that? Yeah. And it didn't take very much to bring that back up to temperature. She could feel that it was hot. That's a great sign, because what we're knowing is that that energy is still under there. And that's improving that collagen, and that skin tightening is happening, and she's completely comfortable. So we can do one more on each outer quadrant and we'll be all done. And see, with the amount of energy we've laid down, it doesn't take very much to bring that up to temperature. One more. And she's going to do last turn. Okay. And that'll get it even. Don't want to cheat one corner. So there you go. Now if you were going to treat a wider area, you could, if this was for, but that's your skin tightening on the abdomen.
The way I felt about my appearance before the treatment was that my skin was starting to sag a bit. I felt it in my lower jaws, around my mouth. My mouth was starting to droop, and I felt a little skin in through here starting to begin to appear the way I didn't like it. So that's one of the reasons why I went to the skin tightening. My husband is quite younger than I am, and he's my first and only husband, and it's always been a challenge for me to continuously keep up with my aging process because I love him so much and I always want to look good for him. And so the more that I can do to keep up my aging process to slow it down for my husband and for myself, the better I feel about it. And he remarks about it all the time. He likes the way I look, and he'll always kind of joke with me a little bit and tell the doctor, go ahead, rev it up a little bit more. I've had two types of treatment of the Skin Tyte. In the beginning, when I had it done, it was held to one area until a certain amount of heat came, and very uncomfortable, and then moved on. I found this treatment to be quite uncomfortable and something that I wasn't too sure about doing, but because of vanity, I sometimes want to just say, all right, I'll do it. But when the doctor started doing a movement treatment on my face, it suddenly became much more comfortable. The heat was there. I could feel it at some tiny points, but it was always, always comfortable. After receiving the treatment, I could walk out of the office without any redness. The results were immediate. I could look in the mirror and see right away that I saw a difference, although subtle, a difference. And then as the days progressed, I could feel, knowing that, you know, the treatment was actually working from below in the dermis area, that as the days went by, things were looking better and better, and I could actually see my skin improving as the weeks went by. The skin tightening treatment that I'm doing, I recommend to so many people. I have friends of mine talking about quick little plastic surgeries that they want to have done to tighten it up, and they ask me what I do, and I definitely recommend this treatment to as many people as I can, especially if they want to stay away from surgery and do something non-invasive on their skin. The way I feel about my skin tightening results is that they've been working for me, and I'm slowing the aging process, which is something that I wanted to do, and I'm feeling so much better about myself and knowing that this is a healthy treatment that is quick and comfortable, and again, like I said, no downtime, which for me is great because I'm always on the run.
Skin Tyte is Cyton's skin tightening procedure. It refers to the use of broadband light technology. It's the infrared wavelength specifically that is used to deep-heat collagen, and it does actually work in two phases, basically to heat the collagen and contract immediately the bonds, and then over time that leads to remodeling of collagen and tightening of skin. I think when we talk about Skin Tyte, we need to emphasize that this is a skin tightening, so we're going to have really a benefit to anyone because the fact that skin thins is an aging process. I like to see skin tightening as part of any kind of skin program, whether we are trying to treat skin for texture or for just rejuvenation in terms of fighting laxity, but in fact any patient can benefit from skin tightening as far as their long-term fight against aging. When I first started using the Skin Tyte by Cyton, the traditional method really required that the heating without motion was much more uncomfortable. In order to get enough energy into the tissues to really see results, I really needed to decrease the amount of discomfort and give them a treatment that they would be willing to come back for again and again. I do think that if you use the motion when we get less discomfort, in fact to the point where now patients look forward to coming into a skin tightening treatment, it will be something that is really used to its maximum benefit because they have repeated treatments. There is an adapter now that goes on the IPL crystal of the IPL handpiece by Cyton, and it actually rounds the edges of the crystal, which is now above the base of the handpiece. so that that not only blocks out light that comes from the side of the crystal, so that now as a treatment for the physician, you can watch what you're doing without worrying about a lot of flashback from the light. And you can also smoothly glide the edges, so you can roll the handpiece instead of having to keep it totally perpendicular. You can roll it a little bit up over curves so it comes up over the jawline. So it's just a little adapter, attaches to the crystal with a magnet, very easy to take on and off. I use it for all my IPL treatments now just because it's so easy to just get the benefit of what you're trying to do in sending light down into the skin and not scratch anybody with the side of the crystal. So it's a nice addition. Maintenance is really on an individual basis, but I do think that everyone would be encouraged to protect their investment and to continue to do skin tightening on a possibly every 3 or 4 months, or more often if they choose to just make sure that they don't lose the benefits that they've received. The main reason that Cyton, I feel, is the best investment I've ever made is because of its quality and its reliability. I have really total confidence that the company produces the best product on the market, and if they can offer me the technology, I would always look to Cyton first.